Hello and welcome to the NIDILRR Grantee Stakeholder meeting. At this time, all participants are in a listen-only mode. Following today's presentation, you will have an opportunity to ask questions. You may register to ask your question or make a comment at any time by depressing the 1, then 0 on your touch-tone phone. You may withdraw yourself from the queue by once again depressing the 1, then the 0. Please note, this call is being recorded. I will be standing by if you need any assistance. It is now my pleasure to turn the meeting over to Dr. Angeli Forber Pratt, Director of the National Institute on Disability, Independent Living, and Rehabilitation Research. The floor is yours, Doctor.
Thank you so much, and thank you everyone who's taken the time out on this busy Wednesday afternoon to join us. I'm truly honored to have recently joined the Administration for Community Living, ACL, to serve as the Director of NIDILRR. I wanted to share a little bit about me and my background. I know some of you, but certainly have not yet met all of you. I really sit at a large portion of intersections of multiple identities and stories. I am a person of color, adopted from India. I use a manual wheelchair. I'm also a Paralympic medalist and a researcher and an activist. In our very brief time here this afternoon, I'm going to share a little bit about my story and background and some of my musings about disability research and a little bit about what I hope to accomplish in my time as director. I'm also just thrilled to finally be at least having this touch point with each of you as grantees, and I certainly hope that one day soon we will be able to meet those of you who I don't know in person. One of the most refreshing parts about joining NIDILRR is being around disability researchers every single day, and the work that you all do as grantees in the disability research space really matters, and it makes me excited to come to work every day, and the work that you do for disabled Americans and for the broader field of rehabilitation research. As I said, I use a manual wheelchair. I was adopted from India when I was 2 months old and grew up with 2 parents who are white, and I have 2 siblings who are biological and 1 brother who is adopted. 2 months after arriving in the United States, I got sick with transverse myelitis when I was about 4.5 months old and became paralyzed from the waist down. About 6 years later, President George H.W. Bush made history when he signed the Americans with Disabilities Act into law. And as a 6-year-old, I don't remember much about this momentous occasion, but what I do remember was growing up as a young child and missing out on having role models and representation and people that I had in my community where I felt like I saw myself in them. And part of this was the lack of adults with disabilities in the network that I was in. I really felt like, that in order to become an adult, that I had to first get rid of my disability, and that in order to go to college, have a family, do these things that we aspire to. And it was one day when I really realized that this disability thing was here to stay, that I had to start to figure out where I was going to find these role models, where I was going to learn how to live my life, disability and all. For me, that draw happened to be disability sport, where I saw wheelchair racers who were competing in the Boston Marathon, and it was so pivotal for me as a young girl to be able to see myself in these other racers. So much so that, and connecting to the time of year that we are in, this was so powerful for me that I started dressing up as the winner of the Boston Marathon for a recurring favorite Halloween costume. And having the power of role models and that power of representation was just something that was so deeply meaningful to me at that young age. And it really set my life and my professional trajectory on this path of really wanting to be that representation for the broader disability community. As I moved through undergraduate schooling, graduate schooling, and entering the academy as a professor, as I moved through all of these different academic spaces, I once again found this lack of representation to be rather dismal. And I think it's important to talk about this from 2 different perspectives, both as researchers with disabilities and as researchers and as the generators of the science and so forth, but also as individuals with disabilities as study participants. For me, it's important to be that representation that I always wanted and to ensure that other disabled researchers and the broader disability community see themselves represented in our field. As researchers, we know that there are, unfortunately, quite a lot of negative statistics facing people with disabilities, but I'm also really struck by the stark numbers of statistics in terms of researchers with disabilities. So this is certainly an area of emphasis that I want to work on during my role as director. A huge mission of this particular administration is also to work hard to combat inequities that come from the intersection of disability as well as with race, gender, class, gender expression, sexual orientation, poverty, and other power imbalances. And so as a part of my role as director with NIDILRR, I plan to really move this work forward. We do have 3 equity centers that are forecasted for the upcoming fiscal year to call on work across our domain areas of employment, health and function, and community living in a very intentional way. One thing that I want to expand briefly on is what we mean by equity in and across NIDILRR's portfolio and our research processes. For me, it's really about making sure that we're not amplifying one disabled voice more so over another, and that we're having representation across our portfolio to ensure that research is occurring that is truly representative of the entire disability community, including those with high support needs. I want to build bridges and stronger bridges with disability researchers who don't know what NIDILRR is, with disability-related organizations who can be partners, with researchers without disabilities who are doing incredible work in this space. I want to tackle issues that have been deemed too complicated to research or what we hear from the community, but there's no evidence for that. We really have a long-standing commitment to focus on these long-neglected problem areas and areas that are bubbling up from our community. The specifics of what these things are or will be, I'm still learning the vast portfolio and mechanisms and learning alongside my wonderful staff. But one little nugget is that as a 2-time Paralympian, I certainly hope to bring some aspects of sport and recreation into the health and function portfolio. I hope to continue the work with engineering folks to ensure that whatever technologies are being researched and created, that there's an interest of adoption and usability from the disability community at large, not just a small subset of a more privileged white, predominantly disability community who can often afford things out of pocket. So that ties back into some of the equity work. I want to expand our work with our knowledge translation centers, our KT centers, and our ADA national network to help the good work that each of these individuals and entities are doing to make sure that the research gets out to them. Oftentimes, research gets published with some really fascinating or helpful findings that doesn't always get into the right hands to keep it alive and to potentially shape or point to the need for future or expanded work. I also believe that we need strong, rigorous, quantitative and qualitative and mixed method studies. From my perspective, one is not better than another, and all can be equally rigorous. Oftentimes overlooked, multiply marginalized communities don't have those large N's for analyses as needed, and those nuances may get washed out in large RTCs or get grouped in ways that may miss important nuances that our qualitative paradigm can dig deeply into. And so I really do think that setting the tone of having that rigor across all types of inquiry is particularly important. On the employment side, I want to know what interventions work to retain disabled employees. What is the role of having others with a shared disability at work to navigate? I personally am a scholar of disability identity, and related to that is this notion of disability representation and the sense of community. And these are 2 driving forces that I certainly see shaping my vision during my time here. I do know that we received several questions in advance, so I'd like to go through some of these questions that came in and also invite individuals who have questions, as our moderator said, to indicate that you have a question here on the line. So one question that came in was that did we anticipate any modifications in the use of cooperative agreements, and would those be reflected in updates to NIDILRR's long-range plans? So NIDILRR uses the cooperative agreement mechanism in instances where we anticipate strong ACL or NIDILRR involvement, or when grantees may be having difficulty achieving their aims. but we don't see this really really changing or being highlighted in our long-range plan. The second question was, would there be any opportunities for public input on the development of fiscal year 2023 priorities? So really, what we do provide opportunities for is input on our long-range plan, and the long-range plan is really what then shapes the individual budget year's priority. So as we move into revisiting our long-range plan, there will be opportunities to provide input there. Can we speak to opportunities for grantees to collaborate more closely? Yes, absolutely. So as I shared, I want to better connect our NIDILRR grantees with our knowledge translation centers and with our ADA national network. We're happy to receive any additional input that you all as grantees may have in order to better facilitate this more increased collaboration. So this is certainly a priority area of ours as we move forward. Excuse me. A slightly more technical question came up, which was, what are expectations for single-site IRB reliance for grantees? I'm just going to say very, very briefly that yes, the single-site IRB reliance is applicable to NIDILRR grantees, and I would strongly encourage individuals, if there are questions about that, to reach out to your project officer, and we are more than happy to answer further questions. The HHS Office on Human Research Protections does have extensive guidance on their website as well. And again, this single-site IRB applies to multi-site projects that are funded by NIDILRR and by other federal entities. Can I comment on research projects that are continuing to carry forward funding for 1 year? This question was a little bit unclear to us, and so and also a little bit rather technical. So I'm going to again reiterate to please reach out to your PO, to your project officer, and we are more than happy to also directly follow up based on that question. Did I foresee any new priorities or areas of emphasis in the future? I did share a couple of those in my brief remarks, and yes, this is still a work in progress. One that you're going to hear quite a bit more from in the coming months is certainly related to equity across our domains. Could I comment on the future capacity of building programs in NIDILRR, such as the Advanced Rehabilitation Research Training, ARRT program, and its impact? For many years, the ART program was held with separate grant competitions across each of our 3 domains, and so what we found by separating that out by domain was that then one particular domain area was not overemphasized over another, and so we do plan to continue this approach and to continue building capacity for advanced disability research across the domain areas. In the future, you may anticipate a greater focus and emphasis on recruiting and training postdoctoral researchers with disabilities. This certainly has been a longstanding focal point for NIDILRR, but also one that I am personally committed to. We had a specific question, which was, what is NIDILRR's planning in terms of research and technical assistance to address the direct support workforce? This was, and there was also some commentary in terms of just the extreme workforce turnover and vacancy rates at this particular, the DSP support personnel that we're seeing nationally. First of all, we really appreciate this input, and we rely on the expertise and leadership, particularly of our RRTCs in this particular area. I personally also hope that in our field-initiated competition that we get proposals related to this need, and really across all of our mechanisms. We tend to see themes of importance that are affecting the broader disability community that you all as applicants also put forth. So we do expect that there will likely be work to be done there. A question in terms of vision for the next 5 to 10 years for the agency and goals and outcomes. I think I've covered that in briefly in my remarks. As I also said, this is still a work in progress. I am so glad to be engaging with you all as grantees, and look forward to having more regular touch points with you all. And so I hope to be able to flush that question out more in the months to come. Another question was, do I support the hiring and promotion of people with disabilities? And connected to that, do I support the hiring and promotion of people with disabilities over the able-bodied population due to the lack of inclusion and discrimination over time? Yes, I would say that I do strongly support the hiring and promotion of people with disabilities. And sometimes individuals with disabilities need additional supports in order to gain the same access. To me, this really is equity and inclusion in action that recognizes the historical and systemic barriers and intersections thereof in order to move the needle. Unfortunately, as many of you on this call probably already know, the unemployment rate of persons with disabilities in the country is rather high and has remained high consistently over time. And so I do think that in some cases we do need to prioritize and really also look more deeply across the equity populations, the subpopulations of people with disabilities. Question of what are my plans for promoting health equity among racial and ethnic populations? So I've touched a little bit on some of the broader equity initiatives. I did want to point out that of the three forecasted equity centers, there is one related to health and function. There's also across our other domains of employment and community living. And this connects also back to another question that we received related to the equity centers, where individual was wanting a little bit more clarity on the equity centers in terms of whether the population of focus should be a specific disability subpopulation or serving across disability subpopulations, and vice versa in terms of racial ethnic subpopulations was what the question was that came in. And I just want to point out that as of right now, we anticipate that either cross-disability populations or population-specific and a subpopulation within the equity groups that are mentioned in the forecast, race, ethnic, LGBTQ, and poverty, would be what we are looking for. However, the details of this are still being worked out, and we encourage you to look for the full funding opportunity announcement that will be coming in the coming months. With that, those are all the questions that we received ahead of time. So are there any questions on the line?
For our phone participants, if you'd like to ask a question or make a comment, please press one, then 0 on your touch-tone phone. You may withdraw your comment at any time by pressing the 1, then 0. Once again, to ask a question or make a comment, please press 1, then 0 on your touch-tone phone at this time. And our first question will come from the line of David Boone. Please go ahead.
Hi. I was curious if NIDILRR would have any focus or direction that would engage rehabilitation research in low-income countries outside the U.S.
That's a fantastic question. As I'm still learning, there has been grant mechanisms that have been covered internationally in the past. Although my understanding is not within more recent years. This is something that I'm wanting to learn a little bit more of the history on and what mechanisms might be possible. I think it's safe to say that is not going to be something that is immediate. But I do hope during my time to really be able to revisit potentials for international support. Dr. Hill, is there anything that you would add to that?
No, I think you've covered that well. Thanks, Dr. Forber, Pratt.
Thank you.
Our next question will come from the line of Michelle Mead. Please go ahead.
I guess, Dr. Forber, Pratt, two questions. First, what would you say would be the best mechanism for enhancing the capacity and involvement of scholars working at the intersection of disability and racism?
That's a great question, Dr. Mead. Thank you for that. So I would say we have two mechanisms that really are focused on the capacity building of the field in terms of for trainees. So that would be the AART mechanism and also our Switzer Fellowship mechanism. From my perspective, I see value in both, and I'd like to ask Dr. Hill or Dr. B, who's on the line, if they have further comments about the specific mechanisms.
And not hearing any, if I can follow up on that, do you have recommendations for ways of encouraging the hiring of scholars at the faculty level working at that intersection? There's definitely the capacity building in those, but it's getting, identifying and bringing these other scholars from across disabilities, whether it's from political science and disability studies and such, into these grants in a meaningful way.
That's a great question, and this is something that I think that is it's a challenge in that I think that there's multiple ways of approaching it. So I think that on the federal side, I think that from you all as grantees and in some of these pipeline building mechanisms is certainly one pathway forward. I also think that having recently been situated at a university, being able to leverage existing diversity, equity, inclusion hiring lines to include disability and to really have that intentionality of showcasing that disability is underrepresented in these scholarly spaces is particularly important. And I think that we need both. I think that we need both to be addressing this from the university side as well as from the federal side in terms of ongoing investments related to the pipeline building, but also making sure on the federal side too that as we invest in these future scholars, that they're getting the supports. And I do think this carries over to once the individual gets their foot in the door, so to speak, at a university, especially who is multiply marginalized, and making sure that they're receiving the supports that are needed and recognizing that they may not know what supports they need, and so needing to change maybe our model of providing that support. And that's the same for us in terms of grantees with these fellowship mechanisms, to making sure that they're getting the technical support and support to be successful. And to me, that's part of the commitment that we have to grow and deepen the field.
And do you see the RRTs or any of these being able to catch individuals earlier to encourage involvement or in the disability research earlier, whether at the undergraduate level or such as part of the mechanism, or even at the community level for citizen scientists or research liaisons?
That's a great question, and I hope so. I don't know yet in terms of what is possible within our existing mechanisms, but this is something that myself and the NIDILRR staff, we really are diving into to figure out at what point do individuals find out about the AART mechanism or the Switzer mechanism. At what point do individuals in early on in graduate school, do they have their eye on NIDILRR grants or as being staff members working with investigators on NIDILRR grants, or as you said too, in terms of undergraduate research? I think part of that is also educating the broader field, and this goes back to one of the comments that I had made earlier of really, I think that you all on the call know that NIDILRR exists because you are grantees, but I think that there's a subset of disability researchers and of folks that might be working with individuals who are have strong potential to be NIDILRR grantees that don't know that NIDILRR exists. Mm-hmm. So some of it is getting the word that NIDILRR does exist out to broader broader entities, broader conferences related to just engineering more broadly, related to psychology more broadly, just as examples. And so really thinking of what are the places where we need to do a little bit more education of what is NIDILRR and how and to so that individuals can have those goals of becoming a NIDILRR grantee or working on a NIDILRR project and so forth.
Right, and I was specifically thinking about the requirement within ARTs that folks have a terminal degree, and thinking about developing types of programs that as more of a stepping stone as well.
Yeah.
That type of thing. And I'm sorry, my second one was related to the disability centers, and if there was an intention or a plan for those to be really focused at minority-serving institutions, or to encourage collaborations with those, or if those were more broadly conceptualized.
And just for clarification, do you mean the forecasted equity centers? Is that what you're? Great question. So as is outlined in the forecast document, and any university or organization that meets that criteria would be eligible to apply. We do have other mechanisms that are specific for minority serving institutions and things like that, but these centers will not be restricted in that way.
Okay. Thank you very much.
Yep.
If there are any additional questions or comments, please depress the 1-0 at this time.
While we're waiting, Dr. Forber Pratt, this is Phil Beatty from NIDILRR, and I just wanted to pick up on the previous discussion, and Dr. Mead correctly pointed out that the ARRT program is specifically for training postdoctoral researchers. The Switzer Fellowship Program is primarily for those with a terminal degree, but can include some advanced predoctoral work. Beyond that, I would say that grantees across NIDILRR's portfolio do a lot of training in the sense that they include staff at the undergraduate level, or they include trainees at multiple levels of education. Many of our grants have the citizen researchers that you spoke of. And so I think there is really a lot of opportunity for training across our portfolio, and it's really in the hands of, and in the our applicants have the ability to propose staffing structures that meet this need that Dr. Forber Pratt has pointed to. So those are just some additional thoughts.
Thank you so much.
Andrew Houghtonville, please go ahead.
Yeah, hi. My question is, there used to be undergraduate fellowships that NIDILRR gave out. I remember maybe 15, 20 years ago having students work a full year with a scholarship. Does that program still exist? And if so, could it be reactivated? Or I'll stop there.
Thank you, Andrew. Quite honestly, as I said, I'm still learning about past programs that have existed. I know that this does not currently exist. However, I will certainly look into it and see what I can learn more. And Dr. Hill or Dr. Beatty, if you have anything else to add, please do.
Regina Furpo Triplet, please go ahead.
Hi, yes, this is Regina. So thank you so much for this call. It's been great. So I have a question. We are relatively new to NIDILRR. We're excited to be part of the community. And I'm wondering, are there any cross initiatives with NIH or any kind of collaborations? Or is there, because we've been a long time NIH grantee, and I'm just wondering what, if any, synergies there are between the two institutes.
That's a wonderful question, and yes, I am constantly in communication with our NIH counterparts, and we work hard to support one another in terms of each other's funding portfolios. A really great example that is coming up is that we have a workshop that's being hosted around disability and pregnancy coming up here in the beginning of November, which that's an example of some of our joint collaborations, and which was joint funding as well as bringing folks together for the convening of where this work has led. So there's a long history of that type of collaboration. That's just one recent example. And we'd be happy to follow up if you have more specific questions individually offline.
All right, thank you.
And we have a follow-up from Michelle Mead. Please go ahead.
And I apologize. I did have questions about, and I apologize if you already answered them, the new requirements that really are working to ensure the appropriate representation of participants from marginalized communities with regard to the recruitment and sample sizes and being able to do meaningful research on them. How does that correspond with regard to absolutes, with regard to numbers, with regard to knowing differences related to social determinants of health, issues of gender, race, ethnicity, and the many pieces that we're trying to make meaningful statements about, as well as different racial groups. How are you conceptualizing that?
Yeah, that's a great question. So I think what I'll start with saying is that we too long these questions, these particular subpopulations have just been ignored, and part of the rationale behind this requirement is to say no, we can't ignore it, and so we certainly understand that that this is a challenge, and it's a challenge for us all, and and so forth. What we also want to accomplish with this is to start to build that robust knowledge and so forth, so that over time we can better answer some of those larger questions. And we know that whenever we're starting off with a new requirement and a new initiative in that way, that it's not going to be perfect, right from the start. But we think that by having it as a requirement, then we're not giving people sort of an easy out of not trying to address. And so, but we also, as NIDILRR, we value the rigor as well as the relevancy of research with the disability community. And this really is meant to be intentional around populations that have historically been ignored. And so we'll see where this goes over time. But by having it be a requirement, it means that we're at least within NIDILRR's portfolio, we are going to build and generate that knowledge that will help to move our entire discipline to that next level. And I think historically, NIDILRR has been a leader in many avenues, such as requiring input of people with disabilities on projects, and we've grown the field so that there are disabled investigators now that are at all levels, right? From students all the way up to full professors, and that wasn't the case 20 years ago. And so I think that this is another example where NIDILRR is really trying to push the field to fill that gap.
Okay. Thank you. And as you're talking, I guess I'm thinking about knowing that disability in general still has to be pushed. There's so many gaps there looking at that have to be filled, and then maybe think about smaller questions that allow for more specific ones, specifically associated with race, without all the pieces in the equation. And so different levels of analysis that may be able to be included that still produce rigorous data, but appropriately are able to make statements based on power analysis and sample size.
Yes, and I think this goes back to my point in terms of needing strong, rigorous, quantitative, qualitative, and mixed method studies to be able to better fill that gap. And so I think that is one way of having these multiple design approaches is going to help us to fill that gap.
Wonderful. And then as a follow-up question related to definitions of race and marginalizations, what are the ranges you're included in the current definition? Where I am, we do have a large MENA population, the Middle Eastern and Northern African, and a significant community. Would that be included, or are we thinking more traditional?
So from my perspective, we have not yet boiled down that level of detail as things are just forecasted at this point. We tend to within the federal government rely on how our federal partners are defining these things, so that we're not adding to the equation of more competing definitions. But we can certainly follow up as we get things a little bit more laid out within the funding opportunity announcement.
Wonderful. Thank you very much.
Once again, for our phone participants who have a question or comment, please depress the 1 followed by the 0. Our next question will come from the line of Corey Moore. Please go ahead.
Yes, Dr. Forber, Pratt. Can you hear me?
Yes.
Excellent. So I'm interested in knowing where NIDILRR is currently in developing its next long-range plan. Where's NIDILRR in terms of that process?
That's a great question, and we are just now starting to have some preliminary conversations related to the next long-range plan. So we anticipate, and as I mentioned, that we do anticipate opportunities for folks to provide input as we move into a little bit more into that process. So right now, it's just preliminary internal conversations, and eventually we'll shift to soliciting input from grantees and from our broader disability community.
Thank you very much.
And ladies and gentlemen of the panel, there are no further questions in queue at this time.
Wonderful. Well, I just want to say thank you so much to all who took the time out to jump on this call this afternoon. My hope as the director here is to have more regular touch points with you all as grantees, and so our hope is to try to do these probably quarterly to be able to have touch points. And again, just as a reminder, if you have any questions, please feel free to reach out. Especially to your project officer. We are here to support you as our grantees. And as I mentioned in my remarks, I hope to one day very soon get to meet you all in person. I miss being at conferences and being able to meet our actual grantees in person. So I do hope that will change over these next few months. But just thank you again for your engagement and for the very important questions. And again, as always, thank you for the work that you all do for the rehabilitation research community.
Ladies and gentlemen, that does conclude our meeting for today. We'd like to thank you for your participation, and you may now disconnect. Thank you for using our service. One moment, please.